Implementation. It is the fourth step of nursing process in which nurse utilizes her knowledge and skill for giving planned nursing care. In simple words, implementation is the process of putting a plan into action. Implementation is the action phase in which initiation of the plan, completion, and recording of the nursing care is done. DEFINITONS. Implementation is the process of actual administration of planned nursing care to assist the patient to achieve the expected outcome or goal. Implementation as a phase of the nursing process involves putting the plan of care, nursing interventions, into effect. Purpose of implementation: to provide technical nursing care, to provide therapeutic nursing care, to help client to achieve optimum level of health. Activities of implementation. Implementation phase of nursing process includes reassessment, setting priorities, organizing resources, performing nursing intervention and recording action. Reassessment: whenever nurse meet client, she will assess the client's condition which may change quickly. Reassessment in this phase ensure that the planned intervention are still relevant/appropriate or not. Setting priorities: as client's needs changes quickly, priorities may also change. Priorities should be set based on reassessment. Ultimately, nursing care plan need to be modified. Nurse rank the nursing problems based on following factors: client's condition, new information from reassessment, time and resources available, feedback from client/family/healthcare staff, nurse's knowledge and experience in setting priority. Organizing resources means arrangement of equipment and personnel for providing best nursing care to client. Preparation of the client as well as environment is pivotal. Equipment: most nursing procedure from bed making to health teaching require some equipment or supplies. Tips for equipment: equipment should be in working condition, e.g. artery forceps, sphygmomanometer, thermometer. Collect all required equipments and put it in convenient location. Extra supply should be available, e.g. sterile gloves, linen. Extra equipment should be used/opened if required. Arrange equipment in the way/sequence these will be used. Replace the extra supplies. Avoid mishandling of equipments. Avoid over/misuse of equipment/supplies, e.g. gloves, dressings, linen. Personnel: while initiating the nursing care, nurse must make sure that required health team member are available. For example, while doing surgical dressing, bed sore dressing, nurse should arrange the assistant as well doctor if required. Environment: the surroundings in which nursing action will be taken, should be safe and conducive to the implementation of care. For example, for crutch walking, in the ward, furniture and equipment should be well arranged. Floor should be clean, not slippery. Ensure that attendant is there. During physical examination/bed bath, privacy promotes relaxation as body parts will be exposed. Reducing distractions enhances client's learning. While giving steam inhalation, air cooler, fan should be switched off. Client should be physically and psychologically comfortable. It enhances his participation and cooperation. For example, reputation is very important to start any patient care. Prescribed analgesic if given before wound dressing, may enhance client's cooperation during dressing procedure. Controlling environmental factors, comfortable positioning and taking care of other physical needs is very important. For example, A. While providing meal to client, room should have good fragrance. B. Before initiating intravenous medication that make sure patient does not want to go washroom. Plan only the amount of activity the client can comfortably tolerate. For example, teaching deep breathing exercises, start it from 2 minutes then gradually duration can be extended. Awareness of client's psychosocial needs helps nurse to create a favorable emotional climate. Provide moral psychological support, it reduces the client's anxiety level and facilitates mental ventilation. Performing nursing interventions. Nursing interventions are those activities performed by the nurse and the client to prevent illness, or its complications, and to promote, maintain, or restore health. A variety of interventions can be selected by nurse. Following are the nursing interventions which nurse can perform. Directly performing an activity for a client, e.g. giving bed bath, mouth care, vital monitoring of unconscious client. Assisting the client to perform an activity himself, e.g. assisting client in doing range of motion exercise. Supervising the client who performs an activity himself, e.g. crutch walking, a child client doing painting. Teaching the client about his health care, e.g. health education on diet, medication, immunization schedule, breastfeeding, etc. Monitoring, assessing, the client in making choices about seeking and utilizing appropriate healthcare resources, e.g., assessing the client having amputated leg for using artificial leg, using crutches, etc. Client having alcohol addiction, etc. Monitoring, assessing, the client for potential complications of illness, e.g., monitoring paralyzed client for complications such as bed sore, constipation, muscle contractures, depression. Performing nursing intervention may vary from simple to complex. While performing interventions, nurse should follow these tips. Check the orders and equipment/instruments. Wash hands to avoid cross-infection. Identify the right patient. Provide safety and privacy to client. Assess the problem. Explain the person/client about what she is going to do. Know the rationale for doing any activity. E.g., while giving medication, nurse must know the indications, side effect, adverse effect of that drug. Involve client and family actively while doing any activity. Always follow institutional protocols and procedure. Recording. As soon as nursing interventions are carried out, they are recorded in the client's health record. Recording the nursing care/activity/action is a legal requirement of all healthcare systems. Each institution have its own guidelines/policies. Nurse should do documentation as per their institutional policy. Sometimes, nursing care plan is supplemented by a record that puts the nursing orders, taken from the care plan. Such record provides space for the nurse to tick off as each activity/action is carried out. Such recording can be reviewed in every shift to see what was done and what was omitted. Only nurses' notes may offer the evidence that medical and nursing treatment have been carried out. Immediately after the intervention, client's response to treatment/activity is recorded. Writing the time and details of intervention documents that the procedure was completed. Recorded information should be legible, clean, concise, and complete. Implementation skill required for nurse. In the implementation phase of nursing process, nurse need to be competent in cognitive, interpersonal, technical skill and psychomotor skill. Cognitive skill. Cognitive skill involves application of nursing knowledge to anticipate and identify clients' needs. Cognitive skill includes problem solving, decision making, and teaching. In order to enhance client's decision-making ability, nurse gives him multiple choices to select which treatments are performed and in which sequence. All these activities, nurse can perform only if she know the rationale for therapeutic/diagnostic interventions. Know nursing science and subjects. Understand normal and abnormal physiology and psychological response. Identify clients' learning needs. Recognize clients' health promotion and illness prevention needs. Interpersonal skills. This is the ability to work with others to achieve a goal. As nurse is considered as backbone of the hospital, she must have knowledge and skill of developing and maintaining interpersonal and intrapersonal relations. Nurse uses communication skill to carry out planned nursing interventions. Psychomotor skill. It requires the integration of cognitive and motor activities. For giving intramuscular injection, nurse need to have knowledge of anatomy and physiology of body, cognitive, as well preparing and administering injection. Motor skill. Such skill are important while doing dressing, wound, giving injection, suctioning, tracheostomy, etc. Technical skill is the skill needed to use equipment. Machine supplies in a particular specialty. Example, equipment such as ventilator, phototherapy machine, suctioning machine, infusion pump, etc.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.